Hello YouTube friends, Gloria Goodman here from GG Skin Therapy in Albuquerque, New Mexico, here to talk to you a little bit about dermaneedling and what I know about dermaneedling and the uses for it. And I've seen some strange little YouTube clips of people doing dermaneedling where the skin is bleeding and I'm like, oh my God. No, that's not right. So I'm going to tell you right now that if you're watching any YouTube videos about dermaneedling, wanting to know what it is, and you see people with blood coming out of their faces, wrong. Please don't pay any attention to those. Shut them off, please. Okay. So anyway, I'm going to tell you a little bit. This is a dermaneedle right here. It's an MTS dermaneedle, which is what I use in my practice. It causes a little wound in your skin, kind of like aerating a lawn. Everybody's, aerated their lawns. They put fertilizer in, and supposedly it helps to create more growth than if you just put fertilizer over the top. This is exactly the same premise as with your skin. And dermaneedling has been around for quite a while. It actually, microdermabrasion was one of the earlier forms of this to abrade the top layer of skin. And then in 1995, a doctor discovered that if you could make little incisions in the skin and put in serums and things to help your skin heal, it would heal and create more collagen and elastin, and thereby having a more youthful look to your skin. You can also use dermaneedling for pigmentation issues, fine lines and wrinkles, scars, excellent for scars. Take a look at my webpage when you're done looking at this video to see some of the before and after pictures that I've done on people with scars. It's really great. Dermaneedling does not work for weight loss, for making your breasts bigger, what other kind of things? Cellulite? No, doesn't work for any of those things. So if that's what you're looking for, you need to try a different method. So I'm going to show you how to use a dermaneedle, or what you will expect if you go to a med spa that does dermaneedling. After you have cleansed your skin and wiped it with some kind of either an alcohol or a prep solution, you are going to use this. If you can see it really closely, it has little tiny needles. This is a 1.0, meaning that it penetrates 1.0 millimeters into the skin. This is actually going to go into the dermis. The dermis is where all of the collagen and the elastin is made in the skin. If you are using a very, very tiny needle that just affects the epidermis, which is the very surface of the skin, that is not going to be as effective for wrinkles, and definitely not for scars. Scars need to be much deeper. And I honestly would not do that one yourself. I would go see somebody who knows what they're doing, because you don't want to rip your skin. Okay, so I'm going to start and just show you a section right here on my forehead. I'm going to take the needle and we're going to go 5 times in a little star pattern. 1, 2, 3, 4, 5. Okay, I've made a little section. Then we're going to go across, not in the same spot. I'm lifting the needle every single time. Okay, so we've made it like a crisscross. Now I'm going to go on the diagonal, lifting, and the other direction. So basically, I have made this little crisscross star pattern, little tiny holes in a section of my skin. I don't know that you can see that. It's kind of red right now, a little rosy. That's what you should be seeing. You use a minimum pressure, just a little pressure on the skin. You may get a pinprick blood, like certainly when I do my nose, I will definitely see little pinpricks, but profuse bleeding? Come on. I don't know who's doing these videos, but they need to stop, because it's wrong. Just wrong. Anyway, so then you would continue the next section, I stopped here before. I would do the next section, working across the forehead, just 4 or 5 times. And this way. And again, on the diagonal. And I usually end up going in an outward area last, simply because you get a little bit of lymphatic drainage that way. Okay, you see how rosy it is right now? And then I would do it this side. I would continue down on my cheek, going across little sections. You can definitely work underneath your eye by pulling down the skin very gently and tilting the roller so you get right up to it. Do not work the eyelid. The skin is just too thin to work on the eyelid. And there are other rollers that, these have, let's see, they're, I believe, 7 across. There are some rollers that you can get that are 1 or 2 across or 3 across. Those are probably better for getting in the little eye area as well as around the lips. Okay, you can roll your neck, you can roll your décolleté, and there are rollers that you can do for your arms. This I think a 1.0 is not deep enough for body skin unless it's really, really thin skin. But if you're trying to work on like a scar tissue or stretch marks on the stomach, you know, like after having a baby, I would probably go with a 2.0. Something that's going to really penetrate deep into the dermis. And that's considered a medical grade roller, and a lot of places will not sell that to you anyway. You'd have to go to a place to have it sold. Okay, here's the very key thing. Once you have dermaneedled your face, and this should take maybe about, 3 to 5 minutes tops to do your whole face, you're going to want to put serums into your skin, something with vitamin C, with peptides, and definitely a good SPF afterwards. So I'm just going to go right ahead and I'm going to use my Pro Light Serum, which is for pigmentation, since that's a big concern for me. I'm going to do that on the areas that I just rolled. Now, of course, you would do the whole face. I'm just doing a little section here today. And you want to get these in fairly quick because you have about a 5-minute opportunity before those little channels that we've just created close up again. Skin doesn't stay open forever. So I'm just putting a vitamin C serum on right now. Vitamin C is really great for stimulating collagen. It helps with that fibroblast activity. And then I am going to use my SPF. This one is a slightly tinted BB, but it has an SPF 30 and it also has some plant stem cells. I use Lyra Clinical. Very good line of skincare. No chemical sunscreens. I would not be putting any chemicals in my face. Vitamins is really what you want. You want to use vitamin A, vitamin D, vitamin C, SPF, and I do a little occlusive barrier with my recovery balm at the very top, so it holds all that moisture and everything into it. And that's it. You're good to go. There's no downtime. I do not recommend going out in the sun after you've been dermaneedled, simply because you are a little bit more sensitive. And, there are different videos that you can watch about dermaneedling. If you need any more information, please, like my channel, send me a comment. I try my very best to get back to everybody and give you a little bit some knowledge that I have about it. I do see results. Now, got to tell you, it takes a while to see big results. The skin takes 28 days to turn over new cells. So don't think you're going to roll one day and the next week, okay, those lines and those pigments are going to be gone. They're not. Skin doesn't work that quickly. But it is a whole lot less painful than doing laser. It does hurt a little bit. Gotta tell you, not gonna lie to you, there's 200 surgical steel needles going into your face. And you can use a topical lidocaine cream, but honestly, by the time the thing gets numb, you could be done. So I don't even bother. I mean, you may want to put a little bit around the lip because that area does feel tender, but it's so quick. You could deal with it. It's really not that bad. But you may notice, like in a couple of months, if you do it every 28 days, which is approximately 3 weeks, 3.5, 4 weeks. After about 4 treatments, you will see your skin looking more homogenized and smooth, and it's really a very doable treatment without a lot of downtime. So thanks again, guys. Gloria Goodman, Gigi Skin Therapy here in Albuquerque, New Mexico, and I'll talk to you soon. Thank you. Bye-bye.